And later on, the Mayo Clinic came out with a startling study that said vitamin C use in cancer could actually promote a quicker death.
Well, that was the study down not Mortel, forget the guy's name. After Cameron and Pauling had published their book, which is a very interesting, very good book, the Mayo Clinic told Pauling that they would repeat his work. They were going to actually reproduce what he and Cameron had done in Scotland. Now, in Scotland, they had started with IV vitamin C and then had gone over to the oral form. But they started always with the IV. And they reported certain therapeutic results. The Mayo Clinic selected a group of patients who don't ever respond to anything. They don't even respond to chemotherapy. But they gave them chemotherapy because they said, what else can we do? These were a group of very sick people who didn't respond to anything. And then when they published their data, and Linus Pauling read it turned out that they hadn't made any serious attempt to repeat his work. They did it differently. So Pauling said, what you did may be interesting, may be valuable, but it's not my work. You didn't repeat what we did, therefore you cannot judge what we did on the basis of what you have done. That's all he said. And that started a major controversy. There was really a red-hot controversy for a long time. I think the Mayo Clinic study has now been mostly discarded by any scientist who thinks about it, although it is still gospel to the medical profession.
I read actually that when Pauling reviewed the work, they had made the study for 2 years, but they only administered the vitamin C for 2 months.
That's right. The Pauling studies, they kept the vitamin C on until they died. The Mayo studies, they only ran them for a limited period of time because as soon as they decided they weren't improving, they stopped the vitamin C.